If you are trying to conceive or struggling to get pregnant, as a biomedical engineer who studies female reproductive health, one of the things that I recommend you look into is your vaginal microbiome. It's not talked about enough, which is very interesting because the science is very much established that a healthy vaginal microbiome is safer for pregnancy. Research shows us that people with an imbalance in their vaginal microbiome have a greater risk of miscarriages, a greater risk of a low birth weight baby, or even a premature baby. So there's health risks associated with an imbalance in the vaginal microbiome. And so there's more research that's coming out as medicine evolves, especially female reproductive health research, that's showing us that the vaginal microbiome can influence infertility. And there's a link between the vaginal microbiome and infertility. Now, it's not ever the sole issue of infertility, but it could be a missing piece of the puzzle for many women, and it's something that's just overlooked. And I think in general, part of the reason it's overlooked is because when we're talking about infertility, our minds go to the upper reproductive tract, like the uterus and the ovaries, and physicians and even the patient themselves might not even think of the lower reproductive tract, like the vaginal microbiome. So it kind of just gets ignored. But research is advancing, and it is showing us that there is a link between the vaginal microbiome and its balance and infertility. So it's at least something to rule out, especially if you are struggling, to at least confirm that the vaginal microbiome is balanced, and whether there's maybe something hidden there, silent BV, you have aerobic vaginitis, you have anaerobic vaginitis, you have ureaplasma with BV, something like that, because a lot of people don't know sometimes that they're having BV or an imbalance. A lot of women are asymptomatic with BV and they have no idea. So it's really important to at least rule it out, especially with medicine evolving and us seeing that there's increasingly more research highlighting that it could be a missing piece of the puzzle. So it's just one of the things to consider if you are on your TTC journey and you are struggling to get pregnant and you want to kind of rule certain things out. If you've been trying numerous things, I definitely recommend looking into your vaginal microbiome and its composition and double checking that your vaginal microbiome is balanced and healthy to rule it out.